Well, brand new information at 10 o'clock. The average time kids spend online has actually doubled since the pandemic. Now doctors are warning about the serious consequences that blue light could have on their vision.
I mean, you talk about teenagers, they've got phones. Most kids, teens or younger, have tablets, and we've got computers, and we've got TVs. And so we've got Dr. Dagny Zhu joining us this morning with more to talk about kind of how we can manage this. Good to have you. You're a board-certified ophthalmologist with Eyesafe Vision Health Advisory Board. Well, we hear about the blue light glasses. Are those the solution?
Hi, good morning. That's a great question. It certainly is one solution, but I think the best strategy is always prevention. You know, the less time we spend in front of our screens, the better. We know that our kids are spending up to 5 hours amongst the 8 to 12-year-olds a day, and teenagers up to 9 hours. And the more they're staring at their screens, the more the blue light is affecting their eyes over time. And there's potential risk to our eye health over a lifetime. So certainly you could use blue light blocking glasses, but I like to get at the source. There's actually blue light screen protectors you can use, and you can apply on smartphones, tablets, laptop and computer monitors. There's even integrated technology within the screens now that emit lower levels of blue light. So there are better options, I think, than blue light glasses these days that really target the source. Plus, glasses are a little bit cumbersome to use for some people, especially kids.
Getting kids to keep those on.
Yeah, they take them off. Yeah, so a screen protector or something like that would probably be a good option. I mean, how big of a problem is this becoming? I know it says it's kind of doubled since pandemic times, kids on their screens. Yeah, that's a huge number. Are you seeing more kids coming into the office with eye issues because of this?
Yeah, absolutely. So a lot of the research shows that even during that pandemic, the incidence of nearsightedness or myopia went up tremendously. And so we're seeing kids having higher prescriptions every year. And part of that is just from sitting too close to the screens and not spending enough time outdoors, because we actually know that outdoors or sunlight exposure is protective against nearsightedness. And so there's things that you can do. If you're using screens, try to hold them further away. Try to follow, the 20-20-20 rule, where you're taking breaks every 20 minutes, looking into the distance 20 feet for about 20 seconds, just to help reset your eyes. And the blue light from the screens, it's not only potentially causing risk to your eye health, it actually affects your sleep cycle. So blue light decreases melatonin release, and so you can't fall asleep as easily, you don't get a good night's rest, and so you're just really tired throughout the day. And we know that in kids, that leads to behavioral problems, depression, poor performance in schools. So you definitely want to stay off your devices and screens that hour that you go to bed every night.
Yeah, which is hard for adults to do, certainly hard for kids to do, but we can pull the devices out of their room and help them with that.
Right.
Maybe this is a stupid question. I'm really good at asking stupid questions. Is there a difference between this, holding the phone in front of my face, and watching a TV that's, 15 feet in front of me in the living room? Is there a difference?
There's no stupid questions. That was actually a great question. I think the closer that you hold your phone, the risk is always higher just because of the proximity, especially in our kids. Again, their pupils are larger, their lenses are clearer, so their eyes don't naturally filter as much blue light as adults do. So the closer they're sitting, potentially the greater risk there is. Also, when you're staring at screens in particular and reading, you're not blinking as much, and so your eyes get dry, irritated, and you get blurry vision, headaches, neck strain. So you get all kinds of problems related to your vision. The great thing is that Eyesafe has partnered with UHC United Healthcare to actually donate $80,000 to 4 school districts across the country, including there in Aurora City Public Schools. And they're going to be able to use this donation to invest in technologies that come with the low blue light emitting screens. Cool. And they're also donating about $4,000 of Eyesafe blue light screen protectors so that the kids can better protect their eyes
and that's great, because sometimes I think to myself, well, there's only so much I can do at home, but my kids spend a lot of time on screens at school, and what are they doing there? So it's cool to see at least one district, Aurora, will have some money to hopefully make a change with that. Thank you so much for joining us, Doctor. Appreciate that. Good conversation, and certainly something a lot of us parents deal with on a pretty regular basis, as in every single day.
Right, and we deal with as adults as well. So good advice. Thank you, Dr. Zhu. Appreciate it.
A new report.